Good evening, Dr. White and fellow classmates. My name is Eileen Rose Cabajes, and today I'm presenting on servant leadership in healthcare. This presentation will explore two leadership theories such as transformational and servant leadership, and focus on how servant leadership aligns with essential values and practices in healthcare. I'll also share why I believe servant leadership is the best approach for my team. Throughout this presentation, I will compare transformational and servant leadership theories, discuss how servant leadership relates to 5 key leadership topics we explored during our class, and finally, I will explain why I have chosen servant leadership as the most effective model for my healthcare team. Leadership in healthcare requires more than just decision-making skills. It requires empathy, trust, ethics, and collaboration, such as qualities that are deeply embedded in servant leadership. Transformational leadership. Transformational leadership is centered on vision, innovation, and motivating people to embrace change. According to DIED 2023, transformational leadership inspires their team through emotional intelligence and strong interpersonal relationships. They often rely on charisma to influence others and create an environment of organizational transformation. While this leadership style can drive high-level change, it can sometimes overlook the individual needs of team members. Servant leadership. Servant leadership, by contrast, begins with a desire to serve others. As DIE 2023 emphasizes, this model prioritizes the needs of the team, encourages empathy, active listening, and ethical stewardship. A servant leader supports personal and professional growth, aiming to develop a culture of trust and service, and in a healthcare setting, this focus on people first aligns well with patient-centered care. Psychological safety and team performance. One of the key benefits of servant leadership is the creation of psychological safety. Servant leaders establish trust and encourage openness, while allows team members to report errors without fear. This not only improves morale, but directly impacts patients' outcomes. DIE 2023 notes that when team members feel safe, they perform better and collaborate more effectively. Ethical decision making. Healthcare is full of ethical dilemmas, and servant leadership offers a strong moral compass. Servant leaders focus on values-driven decisions, promoting fairness and transparency in even the most complex situations. This inclusive approach ensures that all voices are heard, which leads to better ethical outcomes and greater team satisfaction. Team empowerment and growth. Servant leadership invests in development of each team member by mentoring others, delegating with intention, and encouraging autonomy. Servant leaders help grow future leaders. DIE 2023 emphasizes that this empowerment boosts more confidence and team performance. It's not about controlling every outcome, but enabling others to lead. Interprofessional collaboration. In today's complex healthcare environment, collaboration is key. Servant leaders promote collaboration by valuing the input of every team member, regardless of discipline. This leads to better teamwork, stronger relationships, and ultimately improved patient care. When people feel valued, they communicate more openly and effectively. Organizational culture and high reliability. Servant leaders also contribute to building resilient and high reliability organizations. By promoting a just culture, they support safety, accountability, and continuous learning. DIE 2023 describes this as a vital component of sustainable healthcare leadership. Servant leaders build trust-based systems where everyone feels a sense of ownership. So now, with the question, why servant leadership? So why is servant leadership the best fit for my team? Because it aligns with the mission, ethics, and collaborative nature of healthcare. It supports team members personally and professionally, builds a safe and inclusive environment, and reinforces the values we aim to uphold every day. It also aligns with all our course learning objectives by emphasizing empathy, collaboration, and ethical decision making. So, what is my leadership philosophy? My personal leadership philosophy centers on trust, empathy, and growth. I aim to serve first and lead with humility, focusing on the development and well-being of others. Inspired by DIE 2023, I believe that ethical leadership starts with listening, being present, and fostering a culture where everyone can thrive. In conclusion, servant leadership is not just a leadership style. It is a value system that supports ethical care, fosters collaboration, and drives high-quality outcomes. For my team, it represents the most effective and compassionate approach to leadership in healthcare. So that is all for my today's discussion, and here are the references that guided my research and supported this presentation. These include works by DIE 2023, Greenleaf 2020, and other scholars who have explored servant leadership in healthcare contexts. Thank you for your time and attention, and I'm happy to take any questions you may have. Have a blessed day.